Hello there. I'm Sandra Ferguson. I'm Associate Director for Psychology at NHS Education for Scotland, part of the NES Psychology team, which is in a long-term committed role to supporting the implementation of the Scottish Strategy for Autism through the delivery of training and education. I was reflecting on the themes of this conference about human rights for people with autism. I came across a piece written by Professor Baron Cohen, and I've been thinking about how our role as a training and education body can support this. First of all, thinking about the right to education. With about 20% of children with autism being excluded from school, I'm delighted that my colleague Susie OConnor will be able to talk more about her work with children and young people. And the right to equal access to public services. 1 in 3 adults with autism experience severe mental health difficulties because of the lack of support, and a barrier to access to diagnosis has been identified as one of the reasons for this. And my colleague, Anne Joyce, will outline the work to support access to diagnostic assessment through our work. The foundational work of the Optimising Outcomes, the Knowledge and Skills Framework, and the Optimising Outcomes Training Plan were our early contribution to the deliverables of this strategy, and we have continued to build on these over the years, and this year is no exception. I'll tell you just a bit more about us. NHS Education for Scotland, normally called NES, is an education and training body and a special health board within NHS Scotland, with responsibility for developing and delivering education and training for the healthcare workforce and social care workforce in Scotland. NES has a Scotland-wide role as an undergraduate, postgraduate and continuing professional education deliverer, and maintains local perspectives through centres across the countries. To outline our priorities in terms of training and education to support the community, to support staff who support the community of people with autism and neurodevelopmental difficulties, we want to ensure that there is, or to work towards the fact that there is sufficient workforce capacity to allow timely access to diagnostic assessment. This is underpinned, as ever in our work, by the need to ensure that training is informed by implementation science and the best available evidence base. We want to build capacity across the workforce to offer post-diagnostic support, again across the lifespan, and reflecting the range of complexity of needs. NES has increased the linkages across different parts of the health and social care workforce, and is delighted to be have been able to be funded to be working closely with our colleagues across in nursing and AHP to help build this capacity. We want to prioritise working with delivery partners to ensure that we're creating the maximum impact from the training offered, and we want to work closely and to continue to work closely with the wider autism community. The Optimising Outcomes framework has 3 main areas that are identified as priorities. First is the right to timely, effective identification, screening, assessment and diagnosis, and this is something I've personally had a long-term interest in. The other areas are management, support and intervention across the lifespan, and an important area of transitions and change. We're working towards our offerings for working with people with autism to be more routinely threaded through our general training offers, so that we can broaden the abilities that we can to respond to this, as well as increasing the crossover across work streams. And we want to continue to build those opportunities as we go forward. Just to clarify the way that the framework works, as well as the 3 areas that I've already identified, there's also 4 practice types that help us to understand the type of training that might be suitable for the role that you're in. So people at an autism-informed practice level, that's for anybody in the health and social care workforce, including in any setting, and includes the necessary, essential knowledge and skills required by everyone. The Autism Skilled Practice level outlines the knowledge and skills required by all staff who have direct or frequent contact with people on the autistic spectrum, and those whose roles are likely to have a high impact on those individuals. The Autism Enhanced Practice level describes staff whose roles and the knowledge and skills required for those who have more regular or intense contact with people on the spectrum, and where their role focuses specifically on autism itself and on specific interventions for autisms, or where people manage services for individuals with on the spectrum. Expertise in autism practice, it details the highly specialist knowledge and skills required by health and social care staff, for whom, by definition, owing to the particular service role they have a specialist role in the care, management, support, or with people of autism and their carers. So I hope that gives you a sort of broad general overview of the context that we're working in, and I'm delighted to pass over to my colleague, Anne Joyce.
Hello, my name is Anne Joyce. I'm the Adult Mental Health Team and Autism within NHS Education for Scotland. And as Sandra says, we've been working to support the delivery of the framework. We're focusing on the identification, screening, assessment and diagnosis, and planning on using an implementation science-informed approach to offer diagnostic training programs that are at varying levels of expertise for multidisciplinary staff across the Scottish NHS and partnership organisations. In 2019, we carried out a national scoping exercise using our psychological therapy training coordinator network, and discovered and identified some very clear and significant gaps in the provision of diagnostic assessment training across the Scottish NHS. So we saw this as a priority to our vision is to support an autistic person's right to have an access to good quality diagnostic assessment. So we saw this as a priority area where we thought that we should be training clinicians to enable them to identify and screen, to perform structured diagnostic observations, and to undertake complex assessments. So over the past year, we have been working quite hard actually to commission delivery partners who will work with us to provide a national programme of diagnostic training each year. And we are very pleased to be working with Developmental Diagnostic Dimension Interview Short Version, 3DI, and the Scottish Consortium for ADOS, and DISCO, the Diagnostic Interview for Social and Communication Disorders. So our plan is to ensure that really good quality training in the identification, screening, assessment and diagnosis of autism is provided each year and is free at the point of delivery. With regard to the management support and intervention aspects of the framework, our aim is to collaborate, create learning resources and deliver training, consultation and support to improve knowledge and skills in autism. This includes providing accessible digital education for all and designing and providing specific training to increase knowledge and understanding within the workforce. NHS Education for Scotland provides a learning platform to host learning resources for all staff working across the public sector in Scotland. So our goal, we have been working over the past year to create an autism site that brings together all the digital learning resources for staff into one platform. This has included the Transitions and Change module, which we were very delighted to launch in late 2018. And since then are delighted that over 350 people have accessed this training resource and indeed completed it in that time period. We also plan to bring over from the NHS Knowledge Network the web resources that have been designed to promote positive practice with primary care practitioners, and the e-learning module that is designed to support practitioners to access key advice about adapting their routine consultations in primary care to accommodate the needs of people with autism. We also will make our key considerations in promoting positive practice for autism available on that site too. And we also intend to build and incorporate our resources around differential diagnosis and comorbidity in autism. So NHS Education for Scotland commissions cognitive behavioural therapy education to increase the number of CBT therapists that are available within the NHS. And we also have plans to provide training in adapting CBT for adults with autism. Sadly, our plans were interrupted by the pandemic, but we are on track to get our plans in place to make sure that that training programme is delivered, and we aim to deliver it each year. Our future plans include building on this work and increasing the training resources that are available to staff working in the Scottish NHS and wider public sector. I'm now going to hand you over to my colleague, Susie, who works in CAMS.
Hi there. Thanks very much, Anne and Sandra, for your overviews so far. My name is Susie OConnor. I'm a clinical psychologist and I'm the lead for early interventions and for autism for children and young people at NES. I'm here to tell you how NES is working to develop the knowledge and skills of the child workforce across Scotland so that they can best support children and young people who have autism as well as their families. So just to start with, I wanted to say a bit about the policy background for this work. Getting it right for every child, or GERFIC, and the wellbeing strand of the Curriculum for Excellence mean that a wider workforce is now explicitly involved in the promotion, prevention and care for the wellbeing and mental health of Scotland's children and young people. So to support this approach, NES is working together with stakeholders, including children, young people and their parents, to develop a mental health and wellbeing knowledge and skills framework for all of those who work with children and young people across Scotland. So we intend this framework to inform workforce planning and commissioners of training, also for educationalists to design curricula content and to inform professionals' personal development plans, and just generally to help to standardise our understanding of mental health care across agencies and also our use of language. And this framework will be launched in December 2020. A key outcome of the CAMS task force and the Children and Young People's Programme Board is the CAMS NHS Scotland National Service Specification document, which can be found at the link below. And I've also included the new model, which intends to address some of those historical issues with access to mental health and wellbeing assessment and supports. And we are delighted that it has an explicit focus on neurodevelopmental services, which of course includes autism spectrum conditions, along with other commonly co-occurring difficulties such as ADHD or attention deficit hyperactivity disorder. So NES is delighted to work alongside the National Autism Improvement Team, or NATE, who are working in partnership with regional health boards to develop appropriate care pathways for children and young people who have such neurodevelopmental complexity. So here at NES, we offer training and support to professionals who work across a range of child agencies. And so I'd just like to say a little about that work, just broken down by the work setting. So first of all, just some detail about the training we deliver to Tier 3 and Tier 4 child and adolescent mental health services, or CAMS. So In addition to various awareness-raising activities, so for example, in February 2020, before the COVID lockdown, we delivered an autism awareness training session for 80 nurses across paediatrics, health visiting and school nurses. So as well as that awareness-raising work, NES CAMS also offers training in psychological therapies that are intended to support children and young people and their families, and that includes those who have autism. So, for example, we commission a CBT diploma course via the University of Edinburgh that includes the adaptation of CBT for children and young people who have depression and or anxiety in the context of autism. And we also offer follow-up supervised practice to ensure that these new skills are translated into changed work practices with children and young people. We're very aware that a significant percentage of children and young people who have autism also experience trauma and eating disorders, anorexia nervosa, and difficulties with family interactions. And to address all of these difficulties, NES CAMS offers training in evidence-based interventions. So that is trauma-focused CBT, CBT ED for eating disorders, and family-based treatment for anorexia, along with family therapy training and supervised practice. Finally, in terms of CAMS, to standardise the knowledge and skills of staff who are new to the work in CAMS, NES CAMS has developed a one-year development plan of training for all new CAMS staff. And this includes an introductory 2-day training on parenting interventions, which covers the application of parenting interventions to the parents of neurodiverse children and young people. Okay, so this is the work stream that I lead on. It's got a snappy title. It's called Training in Psychological Skills Early Intervention for Children, or TIPS-EIC, and it is a workforce development training project, which is delivered to qualified multidisciplinary staff across child agencies who work with children and young people. So, for example, we train staff who work in school settings, such as school nurses and pastoral care teachers. So this training and coaching is delivered by NES-funded local psychologists and aims to equip staff to deliver evidence-based, psychologically informed practices and interventions to children and young people who have those elevated levels of distress, but who would not meet the criteria for a referral to Tier 3 CAMS. So, as Anne said, we are guided by the principles of implementation science in this work, which tell us that on-the-job support is required to embed new skills into practice, and all our training is accompanied by application to practice groups or coaching sessions delivered by an expert in the technique or intervention. So just to say a wee bit about the TIPS-EIC offers. So first of all, we have Liam, or Let's Introduce Anxiety Management, which is a 9-session CBT approach to target mild to moderate difficulties with anxiety. And this has been well embedded across a large number of health board areas, and we have gathered outcome measures that tell us it delivers significant reductions in anxiety for those children and young people who receive it. And we are planning within the next year to adapt Liam so that it is more suitable for children and young people who have neurodiversity such as autism. The next training is brief behavioural activation, which is for children who have low mood and depression. It's a workbook-based offer, and it's also supported by expert coaching, just like Liam, to embed the new skills into practice and make sure that the right young people are targeted to be seen at this level of care. Now, this is a very concrete and behaviourally based intervention, and as such, it's ideal for children who have autism and neurodiversity, as well as neurotypical young people. And we have just trained all but one health board area across Scotland in this brief BA intervention. Our psychological skills modules are half-day training offers intended to build skills in psychologically informed practice across the child workforce. So they're intended to enhance usual practice, and they are delivered by TIPS-EIC delivery staff, and followed up by application to practice groups to help translate new skills into everyday working practices. Finally, we have 4 trauma modules with follow-up application practices, follow-up application to practice groups, and these are being launched this year too. Okay, so just a wee bit now about the NES POP workstream, which stands for the Psychology of Parenting Project. So currently NES offer 2 parenting group interventions, which are the Incredible Years Preschool Programme and Level 4 Group Triple P in POP sites for children who are aged between 3 and 6 years who exhibit elevated levels of social, emotional and behavioural problems. Although this offer is not targeted specifically at children who have neurodiversity, it is open to the parents of children who have autism. And we're also hoping to be able to support services to deliver additional parenting groups for families of children with autism over the coming year. Also under the POP auspices is access to the universal Solihull Approach online courses. So this is a lovely online universal offer open to all families across Scotland, including those with children who have neurodiversity. And although the courses are not specifically focused on neurodiversity, the Solihull approach is currently developing a new online course for families who have children with additional needs, and when that is launched, it will be made available to all families across Scotland via the POP team. And then our last child work stream are the psychologists who work in medical settings. So these are our paediatric psychology colleagues who are at present developing a short module about autistic spectrum disorders to help paediatric healthcare staff to understand how autism can affect children and young people's presentation in clinic and on the wards and how best to support them there. And it has 3 learning outcomes: to understand the triad of impairments in ASD and how these can impact behaviour, to understand sensory processing difficulties in autism, and to learn strategies to help to support children and young people with autism and to help them cope with their long-term health conditions. Okay, so just in terms of our future plans at NES, we believe that NES Psychology is in a really good position to meet the demand for diagnostic training across the levels of presenting complexity going forward with our ADOS 2, 3DI and DISCO training offers. We are also determined to ensure that once diagnosed, autistic individuals and their families can access evidence-based and timely supports in terms of psychological therapies offered face-to-face, as well as digital resources and information. And that's everything that we wanted to say today. So thanks very much for listening.